but trying to get you some relief. Oh, I did it.
Oh. I think that was the one that I felt the most out of all of them.
More for me. There it goes.
Oh.
When I said pubic symphysis, I meant it.
I've never felt that before.
You said mostly
my neck.
Oh, okay,
And
neck.
my back. So it's like mid back on the left,
Okay.
and then low back. So I do a lot of office work. I'm a physician. So
Oh, what type of physician?
Primary care. So family medicine.
Then there you go. So you're an MD then.
Yeah.
Oh, well then I didn't need to explain all of that.
No, it's fine because what
Okay.
I do isn't a lot of like MSK. I don't do a lot of that stuff.
Okay.
So I mean, it's good to like hear it as like a
hear
refresher and be like, oh yeah, I didn't know that, and you know, like I didn't know the whole it can be undone in like a 2-hour drive. I didn't know that. So
yeah, I mean, because
Yeah.
if you're sitting forward like this at a steering wheel and sitting,
Yeah, and then,
it's
like-
mostly for low back pain.
yeah.
The neck and mid back, if you just can keep like something behind your back on the drive home,
Like a
that
towel
would be,
or something.
Yeah, like you want
Okay.
to more or less stick your chest out. That
Yeah.
will hold it and keep your head back in the seat.
Yeah. So I'm doing a lot of like computer, or bending over patients, a lot of this.
Yeah.
So a lot of my like pain is up in here. I actually have a crick like in my neck right now.
Well,
That's
so
been
all
there
of
for
that,
a couple weeks.
like I can
but-
help you with.
Yeah.
It's just we want to try to keep it. It's almost like you want to mold the structures. You guys are almost could figure it out yourself. Like
Okay.
you really, because a lot of my medical patients,
Mhm.
they get it as soon as they're done, and
Okay.
they don't need to
I'm
come
like,
and
"Oh,
see
I need
me.
to come back."
I mean, they can figure it out themselves.
Okay.
Now, it doesn't mean that you don't. I mean, it's hard to do the neck yourself. It's kind of
Yeah.
hard to reach back there, but a lot. Like I've seen medical students even able to correct their own scoliosis.
Ooh,
They just
nice.
got imaging of their back, and they started putting fulcrums and wedges on the
Oh,
side
okay.
of
That's
the
cool.
apex of the curve.
That's cool.
But do you have scoliosis at all? So, well, everybody has like a slight scoliosis, even in their neck. Looking at you, I do see a head tilt this way.
Like that way?
Uh-huh.
Okay.
And this shoulder, the left shoulder is high.
Okay.
Let's just pretend you're curved this way,
Yeah.
right?
Mhm.
I would put the fulcrum and lean into that and spend time that way.
Okay.
And over time, like braces on your teeth, it will straighten out.
Okay.
Why is that important? Because you know the spinal cord is not this this long, and if we were to stack the bones up on top of each other, they'd be this long.
Yeah.
So they coil,
Mhm.
and when we lose that front to back, A to P, right? We lose that by going forward. We're stretching on that spinal cord. So what does it do? It goes to the side.
Okay.
It has no choice but to coil into the side, and it picks a side early on in
Okay.
life. I want to say before 11.
Oh, wow.
It's already
Yeah.
picked.
It's pretty early.
Yeah, and it's
Okay.
usually how you know, like the little babies in the car seat, and the parents are like letting them go
I
like that. And
know.
I'm like, you know, I just
That always
wanna,
looks so uncomfortable.
I always like want to fix their little heads because
I
I'm
know.
like, oh, this is gonna cause permanent damage, you know, in my
Yeah.
world, you know. You don't want to keep having the baby go to the side. It starts from that, and then it just continues. So
Okay.
now how old are you? Do you mind me asking?
31.
31. So at 31, it's not too bad yet. Like statistics, when you look at statistics.
Okay.
You're at the age where you might be more prone for a disc herniation, though. That happens at your age.
Yeah.
But it's pretty preventable. 55, everything's kind of getting fused,
Okay.
and things have herniated that are going to herniate. Right? I think 80% of the population has a herniated disc by the time they're 55.
Yeah.
You know what I mean?
Yeah.
I say that on my channel, and they're like, liar! And no, it's true.
It's true.
It's just what happens. Like,
Yeah.
you know, it's wear and tear.
Wear and tear.
So
Mhm.
why? Because my point is, why do I want to bring you back to neutral? Is to take the pressure off of the system as much as we can, so that it doesn't degenerate. It just degenerates slower.
Yeah.
It's gonna degenerate.
No matter what. Yeah.
Eyes are on the front of the head. Arms work really well this way. We don't
Not
do
really
this.
much this way. Yeah.
Mm-mm. So you're gonna feel me pull you back
Okay.
and open up the front, the ALL, the anterior longitudinal ligament. I want me
Okay.
to open this up for you, and then compress the PLL.
Okay.
Okay, you want to
It's
compress.
like the opposite of what I've been doing.
That's right.
Okay.
That's right. It's not like that's the most basic way. If you want to get really in the nitty gritty of it, you can go segment by segment and degree by degree. Yeah.
Okay.
I mean, that's how far this goes. So there's a little bit of a twist in the center here,
Okay.
a little bit here. So the shoulder's dropped.
Okay.
When I look at for example, your fingers here,
Mm-hmm.
the right is way lower than the left.
Okay.
Okay, so you are kind of leaning in, and it doesn't just ever lean; it coils.
Okay. There's a coil.
There's always a coil. The spine never
Okay.
just does that; it coils. Yes,
Okay.
yes. And so when you're going to be fighting that, you're going to want to go back and up and over that.
Okay.
We all have to go through physics 101 and 102 at least. You know, if you're holding this is your neutral force, right?
Mhm.
And as soon as you go forward any degrees, you can feel it.
Yeah.
Just hold at the bottom.
Oh yeah.
You know, we want the head here. No crick in the neck.
Right.
Crick in the neck.
I can feel it.
So here's your ear and here's your shoulder.
Mm-hmm.
Now how do we fix that? We don't have, no, we don't I know physical therapy, they teach you this one. I know they teach that one. It's this one.
Okay.
Yes, and then a reduction of the thoracic kyphosis.
Oh, okay.
See how that brought your ear right back over your shoulder.
Yeah.
I wish I could take a picture.
It's so weird.
Okay, we gotta take a picture. Take a picture! So it's more like this, and I'm gonna hold her in this position. Okay. Now you said this feels weird.
Yeah.
Okay, you're gonna do it all by yourself at the end.
Okay.
And you're not gonna be doing that.
Okay.
I don't want that.
This.
Because the turkey neck, what that does is it jams the facets at the bottom.
Okay.
It shears them.
Okay.
They're meant to more or less glide like this,
Okay.
not this.
Okay.
Okay, like if I took a spinal model, when I curl it, they glide on top of each other.
Okay. That makes
They
sense.
kind of sandwich together like that.
Yeah, that would help.
This and then that if you want.
Okay.
You got to take your head back into the curve. Okay. Let me adjust the top first, and it'll feel better.
Okay.
I still feel this congestion here on the left.
That's where I feel the crick in my neck.
Up there at the top.
Yeah.
Okay. Yeah, I feel it. It's just sometimes it gets locked,
Yeah.
and your body's like it guards it. Like I'm not gonna move it. Is it hard for you to turn your head this way? Does it feel weird?
No.
Is it sore up here?
Yeah, just a little bit.
Okay, let me try to unlock that first then. Or this way. Here we go. Left. Oh, baby one. Oh, there's more of it. I just set you up. Right here. And go. That's all that is. Because that joint hasn't moved in a while.
Oh god. I felt that.
That was 1 and 2. That was both of them there. Whee! Feel that?
Mm-hmm.
That's C1 and C2 working like they're supposed to. That's 50% of your range of motion.
Okay.
So we go in there and we deliver a thrust to kind of reestablish motion. That's all it is. It also, if you have any kind of joint like problems, it can help reset those joints.
Okay.
Establish some motion. Yeah. Good. Ooh. It feels weird, sorry. We're almost done. done. I know. The toes are always funky. I'm gonna pull.
Okay.
That's the ankle. Ooh. See how this one moved much more than this one? Okay. Yep. Perfect. Don't need to go further than that. You okay?
Mm-hmm.
Low back all right when I did that?
Yeah.
That's a modified straight leg raise.
Okay, yeah.
Showing
It
you my
is.
I'm showing you my tricks. Yeah, we take you here first, and then I kind of wiggle the talus.
Yeah, that was modified.
Yeah, if I were to do it straight,
Right.
but that would put more force. So
More, yeah.
I bend the knee and see if they could do this first. If they could do
If
this,
you do that, then you can go.
then we can go further.
Yeah.
Yes. Told you, you'll figure it all out by the end. That's the hip socket. Very good. There's the other one. Very good. You're just trying to get some blood in. You know, joints tend to be very vascular. She's like, I'm like, she's like, okay, get it, Dr. Mad Dragon.
Thank you, doctor.
Okay. Oh, yeah, we're tight here on this left-hand side. Okay.
Mm-hmm.
And I'm not even done with the neck yet.
Okay.
I have to come back to that in a second. Lower back feels really good though.
It's just sometimes it gets sore, like after long work days.
Okay, take a deep breath in. Very nice. Deep breath in. And again. Yeah, ribs make a lot of sound. Ribs just make a lot of sound. There's a lot of little articulations on the ribs.
I felt that.
Well, plus the
popping back in the
vertebrae.
place.
Yeah, because you got the ribs that make a sound plus the actual facets of the thoracic spine.
Mm-hmm.
So they make a lot of noise, which we like. Again, I'm going to feel again, okay?
Okay.
See what I did? Yeah, it's still kind of rough over there. This should feel better going this way versus this way,
Yes.
right? This feels better.
Mm-hmm.
Right. You're posterior on this right-hand side.
Okay.
You have a posterior ilium as it relates to the sacrum. So when I push it this way, it's like, ugh, it
Yeah.
takes the tension off the spine.
Yeah.
So that's that coil that I'm talking about, okay?
Okay.
Okay, so what I'm going to do is reach underneath the pelvis here and actually go this way. Reach just to the ASIS. Yep, right here. Take a deep breath in. There it goes. Good. Perfect. Now that is a DO move.
Oh.
I just stole that.
If you hadn't told me, I wouldn't have known.
We take and steal from each other all the time.
I'm sure. I was like, how much of this
I know.
corresponds with each
That's
other?
an old osteopath move right there. I just thought about that as I was doing it. I was like, wait, that's a DO move. Just gonna pull, okay? Skin pulling. It might pinch a little bit. You don't have much.
I don't.
No, so I'm trying not to pinch you. But trying to get you some relief. Oh, I did it!
I think that was the one that I felt the most out of all of them.
She's like, ah! I know, I was like, is she gonna let me do it? I don't think I can get this one. No, I can't. Okay, I got one. Good enough, good
I was
enough.
like, oh my god. What?
Now you- That's it. Doing okay?
Mhm.
Right there. And push. Kind of wiggle that joint. Joints like to be wiggled. I know that's true. They do. They like the vibration. This is where we live, you know, and the adjustment, this right here. You know what? It's enough, in all honesty.
Okay.
It is enough as a profession to just
Yeah.
live here in this joint mobilization world.
And, I mean, people seek it out.
Mm-hmm. Yeah, we're right on those TPs, the transverse processes. I want all of those vertebrae to move. Okay. Now, this is a hard one.
Okay.
You're going to take this back. Now we're going to do the scapula. I felt it more on this side. Let's
Okay.
check out the left. There you go. Good. Now we're going to mobilize the shoulder, take it all the way around, and we do the infraspinatus. Make sure. You know, brachial plexus is right there.
Yep.
Come on over. It's not here though. Not too bad. I'm really pushing on it. Oh, okay. Ow. Okay, I'll be nice. I'll be nice. I'll be nice. Oh, sorry. Here we go.
It's just.
I appreciate
more
the honesty.
tender on that side.
It's fine. If you don't really get worked on, this can feel really overwhelming.
Yeah.
You know, it
And
can.
I've never been worked on there before.
Oh,
so.
then it can really feel strange.
It didn't feel so bad on this side, but this side I was like, oh. Okay.
Yeah, I told you. You feel that? That's just
Yeah, I do.
that's just scar tissue.
Oh.
Like a callus.
Yeah.
When I say scar tissue, there's different causes of scar tissue, but this one here feels like a callus, like on the bottom of your foot,
Okay.
and your body feels that rubbing over and over, and it beefs up that connective tissue. So yeah, that's all that is. And this is more superficial than the work that I did just a second ago.
Okay.
Even though it might feel like I am.
And actually, it does feel pretty superficial compared to before.
Right. I'm right here on the surface. You see,
Yeah.
I'm in the dermis.
Mm-hmm.
And I'm trying to bring it up from the muscle. So the more that you have this done, the less that comes out.
Okay.
I'm all cleaned out. There you go. We deal with a lot of tissue, chiropractors. We're just constantly manipulating fibers. At least we should be.
Yeah. Yeah, the right side definitely felt different.
Right.
compared
It's
to
just not here. I could go
Yeah.
and keep searching. Okay. So just come on up and you can see it. I just have to do the same thing to your lower back.
Okay. Oh, wow, yeah.
So see the little purple?
Mm-hmm.
Now the pink is from just the friction.
Yeah.
Okay. The darkness is the petechiae.
Yeah.
And if we took it up higher, you would see more of this shoulder here.
Okay.
So this is your shoulder again.
Oh, yeah. look
Okay,
at
that's
that.
the petechiae.
Mhm.
It's not too bad. Okay, it really isn't.
Oh,
This
yeah.
is, I know it kind of, the light is shining on
Yeah,
it, but
this
this is
side is
actually
worse.
way, than this side.
Yeah.
So that's is that the side that you said was the kink in that?
Yep.
Yes, it is.
Mm-hmm. That's the
Backward.
side with the kink.
Yeah. So yeah, that's just inflammation
Yeah.
in your neck. Okay, and
Okay.
you got to get blood in there.
Yeah.
Okay. Any radiating pain into your legs?
Mm-mm.
Okay. Yeah, edema there. That's it. And again, just flex the rib cage for me. Yeah, that's it. I can feel them better. Yeah. I'm not sure if you can tell. Well, this side's pretty tight too, but
Yeah.
comparatively, this side is slightly more spasmodic than this side.
I can feel it.
It's up to you.
Yeah.
Is it okay?
Mm-hmm.
Yeah, those are deep in the low back. The skin is very deceiving. You know, I can't just
Yeah.
always tell sometimes until I really get in there. Yeah, that's that tilt. I'm gonna have to count backwards here, okay? It's kind of a spasm here. So this is your curve here
Okay.
that's leaning.
That's usually where I feel my back pain in the mid back.
Very minor. I'm gonna use the scraper again, okay?
Okay. It definitely feels nice.
Usually it's very painful.
Oh.
But it feels good because you don't have too much inflammation.
Okay, yeah. That
Yeah.
makes
No,
sense.
it's good. You're good. You're good.
That's fine.
Okay. Your navicular bone, right, and the
Yep.
cuneiform, they just kind of sometimes drop,
Okay.
and then you lose that arch. Yeah, when you don't have an arch distributed from the ankle to here, it has to bend somewhere.
Yeah.
Yeah, feel that? That's like the beginnings of a little.
Yeah.
Sciatic nerve is here.
Yeah, I feel it.
She's like, I'm aware.
I
feel it.
You're scraping it.
Why are you pushing on it? Debriefing the nerve. Get it out of there. Get some blood in there. There you go. You're wearing shorts, so I'm like, let's do it. I'm going to get it. This one's always sore.
Yeah.
Feel that one? Yep. That one's on everybody. This one not as bad. You don't have it as bad here.
It's not.
So that you know your Morton's neuromas, right?
Ooh, yeah.
That's what this is.
Mm-hmm.
But it's not enough to call it that. But if you wear a tight shoe, it can aggravate it.
Okay.
Well, but it's on everybody. Everybody's got one.
Yeah, and that's the foot where it acts up the most when I wear tight shoes.
Right. So I didn't even know that. So it just by feeling it, do you feel how there's edema in here?
Mm-hmm.
So that's the beginnings of it.
Okay.
Be careful. Don't wear tight shoes.
Okay.
Don't do that.
Because I wear them in clinic.
You gotta get something that's
Better shoes.
like just wider toe box, maybe.
Okay.
You know, you want your toe to splay.
Okay. You don't want them to be all crunched together.
No. If you see people that never have worn shoes, how their feet are shaped,
Mhm.
it doesn't look anything like our feet.
Mm.
They're very wide
Like
here.
Splayed out.
Mm-hmm. I don't think they're meant to be scrunched.
No.
But I know why we wear them, for protection, obviously. You don't want, especially in your field.
Right.
You can't be barefoot like I am.
Heck no. All the fluids.
And then lean away. This is the ears. Good. Nothing there. Good. You don't want it to be there. You want it to be free and like kind of mobile.
Okay.
Lean away. Excellent. No. Excellent. Very good. Excellent. Usually I find something.
Something there.
Mm-hmm. I need you to arch backwards. Yes. Now that locks the facets out, they don't have the rotation now.
Okay.
I could just focus on the sacrum. Just like that. Other side. Whew. Whoa, okay, relax. I've almost got it. I gotta separate. Okay. Perfect, it's in. I just wanna make sure I got the whole joint on your back for me. There you go. This is the third joint of the pelvis, the pubic symphysis. Optional. Let's do it. Just okay, she's like, do it. Okay, bend both of your knees. Press out against my hands. Harder. 5, 4, 3, 2, 1. Excellent. And squeeze. More for me. There it goes. Oh. When I said pubic symphysis, I meant it.
I've never felt that before.
You do have a joint there. And I'm like, 1, 2, and 3.
Cool.
Well, the pelvis, if you're trying to align, you gotta get the front. She knows what I'm talking about, too. Yeah, because, there's so much dysfunction here.
Mm-hmm.
And I'm like, if I want to now stick the belly out, right, and shove a bunch of weight on top of it, I gotta make sure it's okay.
Yeah.
This should be easy enough. Deep breath in, all the way out. There it is. And again. I'm gonna push. Yeah, just like a test. There it is. Okay.
Whew.
You'll feel it. It's fine.
I did.
Yeah, feel it. So that's
Okay.
you can do those.
So I can do
yourself.
that.
You can.
Interesting.
But you have to. It's quite up in there,
Okay.
right in the epigastrium, right in there.
Yeah.
See how it feels? Like take a walk around. Like, do you feel okay?
I feel okay.
You feel. She'll live.
A lot was done. It feels good. Like,
It's been a good hour since I did that,
Yeah.
so it's gonna feel sore.
okay.
That should dissipate. Now, what we did in the beginning, which is kind of just standing here, after all that work, it's better.
Okay.
We just have to teach you to do that.
Okay.
Does it still feel weird?
No.
Take a picture of her.
It doesn't feel weird.
Well, you said it at the very beginning, 2 hours ago.
I did.
Ah! So here's what you look like now.
Oh wow, I look so straight. Like my chest is like.
Right.
Okay.
So it can
Okay.
be done.
Yeah.
Okay, without the feeling. But you just have to really, really stretch that front.
Okay. Thank you so much.
Yeah,
This is
absolutely.
so cool.